Hello everyone, my name is Ankita Jagtap. Today's topic is the blood pressure. Blood pressure is the pressure of circulating blood against the walls of blood vessels. Most of the pressure results from the heart pumping blood through the circulatory system. When used without qualifications, the term blood pressure that refers to the pressure in a brachial artery where it is the most commonly measured. Blood pressure is usually expressed in terms of the systolic pressure, that is the maximum pressure during the heartbeat, between the over diastolic pressure, minimum pressure between the two heartbeats in the cardiac cycle. It is measured in millimeters of mercury, mmHg, above the surrounding atmospheric pressure, or in kilopascals. The difference between systolic and diastolic pressure is known as the pulse pressure, while the average pressure during a cardiac cycle is known as the mean arterial pressure. The blood pressure is one of the vital signs, together with a respiratory rate, heart rate, oxygen saturation, and blood temperature, that healthcare professionals use in evaluating a patient's health. Normal resting blood pressures in an adult in approximately 120 millimeters of mercury. Systolic over the 80 millimeters of mercury. Diastolic denoted as 120 and 80 mmHg. Globally, the average blood pressure age standardized has remained about the same since 1975 to the present, at approximately 127 mmHg in a male and 122 mmHg is a woman. Although these average data mask significantly diverging regional trends. Traditionally, a healthcare worker measured blood pressure non-invasively, but stimulation listening through the stethoscope for the sound in one arm's artery, as the artery is squeezed closer. Mercury tube in the spigometer, and blood pressure reading in a clinical. However, semi-automated methods have become the common, largely due to the concerns about the potential mercury toxicity. Although cost is the use of the applicability to the blood pressure or home blood pressure. And the blood pressure is influenced by cardiac output, systematic vascular resistance, blood volume, and arterial stiffness, and varies depending on the person's situations and emotions, emotion state, activity, and relative health or disease state. In the short term, blood pressure is regulated by the baroreceptors, which act as via the brain to influence the nervous and the endocrine system. The blood pressure that is too low is called as the hypotension. Pressure that is consistently too high is called as a hypertension, and normal pressure is called normotension. Both hypertension and hypotension have many causes, and maybe the sudden onset or of long duration. Long-term hypertension is a risk factor for any diseases including stroke, heart diseases, and kidney failure. Long-term hypertension is more common than long-term hypotension. Blood pressure is generally refers to the arterial pressure in the systemic circulation, However, measurement of pressure in the venous system and the pulmonary